I'm Dr. Shalini, Assistant Professor, Department of Family Medicine and moderator of today's PGCR. Today we'll be talking about adolescent to young adults, building a strong foundation, and this is the part 2 of our presentation. The term adolescent is derived from the Latin word adolesco, meaning growing into maturity. It is a period of transition between childhood and adulthood, and it is the time of rapid physical, cognitive, social, and emotional maturing. This is the time where the foundation for lifelong health and well-being is being laid. WHO defines adolescence between the ages of 10 to 19 years, and according to the Government of India, the adolescence is between 13 to 19 years. Again, it is further divided into early, middle, and late, that is between 10 to 13, 14 to 16, and 17 to 19 years respectively. Adolescents constitute almost 1 to 3 billion of global population, that is 16% of the total. India has the largest adolescent population in the world. That is about 18% of the total population of India belongs to this age group. So why it matters? Why we have to talk health conditions in adolescents in a different way? Demographic dividend of any country is driven by its young population. As you can see in this age pyramid, the maximum population of India belongs to the young population and the adolescent age, that is between 10 to 24 years. This is the age where the risky behaviors often begins. Substance abuse, unsafe sexual practices, and also early onset of obesity, eating disorders, and other non-communicable disease risk factors arise during this age, long before these issues becomes evident later in life. So we should intervene now to rather than missing a critical window of prevention. You all must have come across the highlights in newspapers or in the social media. The rising incidence of mental health disorders and lifestyle conditions like obesity and diabetes in this age group, adolescents and young adults. It is not only limited to one strata of particular students or some other, it is also very common in medical students, according to a recent NMC survey. So, for the purpose, as you can see, it is quite common, the mental health conditions and other conditions in this age group. We did a PGCR, that was part 1 last month, where we discussed about the lifestyle conditions, gynecological problems, diet and physical activity in adolescents and young adults. And today's PGCR, we will talk about the mental health conditions, then psychological perspectives, how to communicate, and what best we can understand in the psychological aspects of this age group, and also a brief history taking and a case discussion. So now I would like to invite Dr. Himanshu Ahlawat, second year PG resident from Department of Psychiatry, to discuss about mental health in adolescents and young adults. Thank you.
Thank you, ma'am. Good morning, everyone. Respected senior faculties and my dear colleagues. I'm Dr. Himanshu Ahlawat, second year resident in Department of Psychiatry. I will be talking about mental health in adolescents and young adults under the guidance of Dr. Manju Bhaskar ma'am, Professor and Head, Department of Psychiatry, and Dr. Gitika Chopra ma'am, Assistant Professor, Department of Psychiatry. Before we move ahead, first, let's see why adolescent mental health is so crucial. It is a stage when identity, emotional control, and resilience develop. Biological brain changes combined with social and academic pressures and making adolescents more vulnerable to stress, anxiety, and behavioral issues. Now let's look at the rising prevalence of mental health problems in this age group. According to National Mental Health Survey done in 2015 and 16, around 7.3% of adolescents reported mental health issues. By 2021, the UNICEF survey found that this has nearly doubled by 14%, reflecting the rising stress levels, social media influences, and academic pressures faced by young people. The latest UNICEF 2024 suggests prevalence has further increased to 23.3%, meaning almost 1 in 4 adolescents may now experience a mental health concern. Overall, this progression highlights a sharp and consistent rise, emphasizing the need for preventive interventions, school-based programs, and awareness efforts to address the adolescent mental health well-being. When we talk about adolescents, what's the first word that comes to our mind? Most people say it's the change, and that's exactly right. Adolescence is a period that is filled with changes, physical, emotional, and social, all happening at once. Now imagine juggling all of it while trying to figure out who you are, where you fit in, and what is expected of you. It's no wonder that this stage can feel overwhelming. Mental health during adolescence isn't shaped by a single cause. It is influenced by a mix of biological factors like puberty and brain changes, psychological aspects like self-esteem and coping skill, social pressures like friends, friends from family, even the environment, things like school climate, technology, and media exposure. When these factors starts to overlap, say a teen dealing with hormonal changes, family conflicts, and academic stress, it can lead to a significant stress on his mental well-being. So understanding mental health means looking at the whole picture, not looking at one picture at once, but how all these influence and connect and build stress in an adolescent. Now let's back up these risk factors with evidence from research highlighting the role in adolescent mental health. A study published in Pediatric Research 2025 projected that by 2030, adolescent mental disorders could lead to a nearly 42 million healthy life years. Post-pandemic stress, inequality, violence, and adverse digital exposures were identified as the key contributing factors. Another research published in Journal of Modern Medicine by Dr. Vinod Daria from Kota, Rajasthan highlighted that intense academic pressures, parental expectations, and social isolation are major stressors among coaching students, contributing to rising rates of depression and suicide. Another research from Delhi NCR shows that depression in adolescents is closely linked to poor sleep, unhealthy lifestyle, body image issues, and lack of supportive family communication. Another study by Ahlawat Rajakumar et al. Highlighted that rural India adolescents face mental health risks from social stressors like adverse life events, body image concerns, and tobacco use, as well as psychosocial challenges including anxiety and depression. Having seen the key risk factors, it is important to understand the impact these have. These risk factors can have serious consequences on adolescent mental health, including anxiety, aggression, depression, suicidality, addictions including both digital and substance induced. As you can see in the diagram, all these consequences are interconnected to each other and often influence each other. Now let's move ahead to one of the most common outcomes that we see in practice, anxiety disorders in adolescents. Nearly 1 in 3 report persistent stress or excessive worry. The main triggers for it, academic pressure, peer pressure, and family conflicts. We often see warning signs like poor sleep, irritability, difficulty in concentrating. The good news is school-based mental health programs and active parental involvement can make a real difference by building resilience early on in them. Now moving forward, let's look at another growing concern that often follows prolonged anxiety, depressive disorders in adolescents. Depression in adolescents often goes unnoticed because it is not the usual presentation that we see in adults, that's a low mood. It is seen as irritability, withdrawal, poor academic performances, rather than typical sadness. Genetic vulnerability, chronic illness, and substance use increase the risk of depression. Early therapy, counseling, and strong family support can make a huge difference in the recovery of it. Having discussed the mood-related disorders, now let's turn up to an equally important issue that deeply affects the adolescent self-worth and social confidence, the body image issues. Body dissatisfaction nearly affects 1 in 5 adolescents. Puberty changes, peer comparisons, and unrealistic social media ideals play a major role in it. These often leads to lower self-esteem, depression, or even could lead up to eating disorders. School awareness programs and the media literacy can help building a healthier self-image in adolescents. The dissatisfaction with their body can escalate into something more serious issues, such as eating disorders, which we will explore now. Eating disorders like anorexia nervosa, bulimia nervosa, and binge eating disorders usually emerge during adolescence. These are serious psychiatric conditions, not just mere life choices. Anorexia nervosa involves severe restriction of food and an intense fear of gaining weight. These patients usually have poor insight and often deny being ill, whereas in bulimia nervosa it is marked by binge eating episodes followed by unhealthy behaviors like vomiting or use of laxatives. They usually maintain normal weight, but they feel guilty after it. And in binge eating disorders, it includes repeated binge eating without purging at least once a week for 3 months. These individuals have insight, but they feel significant distress. For treatment, anorexia nervosa needs a nutritional rehab and family therapy. Bulimia responds best to cognitive behavioral therapy and SSRIs. Binge eating disorder is primarily managed by healthy lifestyle choices, but if it goes up to severity, we can use some SSRIs. Having looked at the eating disorders in detail, now we will examine the trends in adolescent suicide. This graph shows suicide trends among children and adolescents in India. After remaining relatively stable till 2014, before 2014, there is a sharp and consistent rise from 2014 onward, reaching up to 10,000 cases by 2020-21. Both male and female show this upward trend. As we have noticed the impact of suicide and its rising trend in recent times, let's discuss it further. Adolescent suicide is sadly on the rise with over 13,000 student deaths in 2022 as per a report by National Crime Report Bureau. Key triggers include depression, family conflict, bullying, and academic pressures, while warning signs like withdrawal or talk of death should not be ignored in them. Prevention needs all of us through school counseling, family supports. Also, there is a national dedicated helpline for suicide, that is Telemana's helpline, that is 1800-8914416. Now, how many of us have noticed children standing outside a pawn shop? Almost all of us. And this shows how common substance use has become among adolescents. This pie chart from Cambridge Prism's 2024 highlights the distribution of substance use in India. The legal and easily available substances are the most common, with tobacco at being 26.4%, whereas alcohol at 26.1%. Cannabis use accounts for 9.5%, while injectable drugs are at lower at 3.5%, but they carry serious health risks. About 34.5% fall under other substances, including inhalants, sedatives, and other prescription drug misuse. Have you ever thought as to why it has become so common? Well, the reasons are not common enough to be ignored. Peer pressure and a curiosity. Many wants to fit in with their friends. Some use it as a coping mechanism for stress and lower self-esteem. Family issues or parental modeling also play a major role in it, whereas exposure or behavior at home influences them. Easy availability and limited awareness makes it easier for them to access substances, and media influence through movies, social media, and celebrity culture can glamorize use and encourage experimentation. Addiction today is not only limited to substance, it also extends to the mobile phones that we use every day. Digital addiction, including gaming, has become a significant concern. It is now being recognized under International Classification of Disease 11. And Indian studies report a prevalence ranging from 3.5 to 10.6%, with an average of around 1 in every 10 adolescents is being affected by digital addiction. And what do all they lead to? Academic decline and dropouts, early addiction risks, leading to lifelong dependence, accidents and risky behaviors, legal and social problems, and mental health issues. Now that we have discussed the psychiatric aspects, now I'd like to invite Dr. Yukta to provide insights into the psychological aspects of it.
Good morning, everyone, to dignitaries, teachers, and my dear colleagues. I'm Yukta, the second-year resident of Department of Clinical Psychology, and I'll be presenting on adolescent mental health under the guidance of Dr. Mahatma. Adolescence is a time of rapid change. It's a phase where identity, independence, and social belonging become central. Due to biological, psychological, and social changes, it's when emotional and behavioral challenges often begin. Communication is different from how we, with adolescents, is different from how we communicate with adults. Adolescents are not miniature adults. They are still developing emotionally and cognitively. Their reports alone may not be reliable, so we need inputs from parents and teachers as well. Building rapport and trust is crucial, as they share only when they feel safe and not judged. While adult communication is direct, with adolescents it must be rational and layered, exploring family, peers, and digital life. In short, it's less about questioning and more about connecting with adolescents. Communication is one of the most powerful tools we have working with adolescents. Adolescents often complain that adults don't listen, and they are right. Most of our communication with them is instructional or corrective. It's important to engage in effective communication with them, which involves active listening, that is being fully present and allowing adolescents to talk without immediate judgment or advice. Open dialogue is inviting the adolescent to share their thoughts. I statements are crucial for non-blaming communication. Validating feelings is acknowledging the adolescent's emotion regardless of whether we agree with their action or not. Clear and consistent expectations is that rules must be known and applied uniformly with the adolescents. And negotiation and collaboration is all about finding a middle point and sharing the control collaboratively. Lastly, natural consequences are allowing the environment to teach the adolescent. For example, when an adolescent hides his marks, instead of scolding, the parent can say that I can see that you are upset, that must have been hard for you. I feel worried when you hide things because I want to help. That's an I statement. Together, they can negotiate screen limits collaboratively and set clear expectations. That is, study 1 hour before phone time. When he forgets, the natural consequence would be staying up late to finish homework. Through this calm and respectful communication, the adolescent learns honesty and responsibility rather than fear. Moving to support systems. So, support systems refer to a network of individuals, relationships, or institutional resources that provide emotional, informational, or practical assistance to a person, especially during the times of stress or difficulty. So, when it comes to adolescence, an adolescent's well-being rests on 4 main pillars: family, friends, teachers, and therapists, who they rely on, be it parents, friends, peers, and sometimes therapists, keeps on changing with age, but these systems largely have an adolescent's back. Starting with family, it is the bedrock for any child. In our collectivist system, family holds immense power to influence behavior and transmit our foundational core values and moral guidance. Moving to friends, they provide a strong sense of belonging. They explore identity outside of family and serves as an emotional support. They introduce new perspectives and ideas to the adolescents. Therapists provide a safe, confidential space, help manage the difficult emotions, develop coping mechanisms and skills, and address mental health challenges. And teachers, they serve as role models for behavior, foster a sense of personal discipline, encourage critical thinking and curiosity, and provides guidance and support. Talking about family as a support system in detail, so they remain the most influential system in an adolescent's life, especially in India where close-knit family structures are still common. The first step is to create a supportive home where the adolescent feels heard and accepted. At this stage, teens are learning autonomy, choosing clothes, friends, and even career paths. Parents can gradually grant increasing autonomy by involving them in choices. This builds responsibility instead of rebellion. Additionally, adolescents may act distant but still crave closeness. Small shared activities like watching a cricket match together or having a dinner together or making something like art, it naturally builds a space for conversations to occur. Finally, parents must remember that they are the role models. Adolescents observe far more than they obey. A parent who can teach emotional regulation more effectively through mindfulness than lectures ever can. So family is what truly teaches an adolescent to buffer against the life stressors. How parents rear their adolescents since childhood greatly influence their personality, emotional growth, and coping. Broadly, there are 4 styles: uninvolved, permissive, authoritarian, and authoritative parenting styles, based on the levels of parental warmth and control. Let's discuss that with a case example.
Hey Mom, Caitlin and I went over to Josh's house. Mom, can I go to Josh's house? Whatever. Hey Mom, Caitlin and I want to go to Josh's house. Who's Josh? Never heard you talk about him before. He's just a guy from school. He's a senior. But who's all school. He's a senior. Absolutely not. Mom, everyone else is going. All my friends will be there. There is no way I'm going to let you hang out with an older guy I've never met before. He's just a guy from school, Mom. He's fine. My answer is no. Mom, end of discussion. Hey, Mom. Caitlin and I want to go to Josh's house. Who's Josh? I've never heard you talk about him before. He's just a guy from school. He's a senior. Well, what's going on at Josh's house? Just some friends hanging out. I don't know Josh or his parents. He's just a guy from school, Mom. That's fine. But I need to give Josh's parents a phone call and make sure they're going to be there. Mom, don't do that, please. Don't you trust me? I do trust you. But I need to get to know Josh's parents a bit. What do you think is going to happen? I just don't want you to find yourself in a situation that neither one of us is expecting. Well, neither do I. And you should be okay with me calling Josh's parents, making sure everything checks out, and then you can go.
Every parent has their child's best interest in mind when they rear them. However, how the child is reared by their parents shape their actions and personality. Uninvolved parenting occurs when parents are preoccupied with work or phones as shown in the video. The child feels unseen and disconnected, and this often leads to isolation, poor impulse control, and helplessness. Permissive parenting, common in urban nuclear families, is when parents face difficulty in communicating boundaries and set their children completely free. This results in low frustration tolerance and emotional dependence. The child is loved but without any boundaries, leading to impulsivity and poor discipline. Authoritarian parenting, where the parents are strict and critical of the child's request, produces obedience but low self-worth. As shown in the video, instead of communicating, the mother closed the channel of conversation with a strict no. The adolescent may obey but struggle with stress and suppressed emotions. In contrast, the authoritative parenting is a combination of the positives of all the other parenting styles. A child needs right amount of rules, boundaries, and flexibility, and that's what authoritative parenting offers. It focuses on a balance of warmth but with structure. It builds empathy, self-regulation, and confidence in adolescents. They feel that they take a sense of responsibility and develop adaptive coping. There are 6 practical actions parents can take to foster an adolescent development using an authoritative approach. First is shift from a manager to a consultant. That is, instead of micromanaging adolescents, advising and supporting them. Then comes prioritizing dialogue. That is, listening before issuing punishments or strict commands. Open communication reduces secrecy, rebellion, as well as fear. Talking about respecting their boundaries, adolescents need private space to form identity. It does not mean neglect. It means discussing limits respectfully with them. Parents should negotiate privacy boundaries explicitly, what's private and what needs to be in the parental knowledge for safety. Simple efforts like knocking the door and asking permission to enter helps them feel that they have the space to be free in their home. Moving to clear and consistent boundaries, adolescents feel safe when the rules are consistent and consequences are explained in advance. For example, if a rule is set in the family that no mobiles would be entertained during dinner, it should be consistent and applicable for all of them. Next is encouraging relationships that offer belonging and healthy modeling. Balanced peer interactions and extracurricular engagement reduces the need for risky coping like substance use or excessive eating. Finally, positive reinforcement like noticing and praising efforts builds desired behavior far more effectively than criticism alone. Reinforcements like verbal praise, privileges, or small rewards that are meaningful to the teen strengthens motivation, self-efficacy, as well as persistence. Our ancient Indian texts typically beautifully describe the balance between guidance and emotional nurture, the essence of positive parenting. Bhagavad Gita, Dharam Shastra, Panchtantra, and Upanishads, all of them teaches positive aspects of parenting in some or the other way. Bhagavad Gita teaches Samatvam Yoga, which is balance in emotion. Parents are encouraged to guide firmly but with empathy, like Krishna mentoring Arjun, being supportive yet firm. It reminds us to model calmness both in success and failure and to instill self-awareness and moral clarity. Dharam Shastru speaks about discipline with compassion, which is Shiksha with Sneh. Through simple rituals like eating together or morning prayers, parents reinforce values gently. It's about balancing authority with affection, setting rules but with patience and understanding. The Upanishads gives us Matra Devo Bhavo and Pitra Devo Bhavo, seeing parents as sacred nurturers. The emphasis is on teaching values by example and not control. When a parent shows humility or gratitude, the child learns those qualities naturally, and the Panchtantra uses storytelling as a tool for moral reasoning. This approach promotes intrinsic motivation where the child chooses right path or right actions because they understand its essence and not out of the fear. So across all our scriptures, the message is consistent. Guide with wisdom, discipline with love, and teach with empathy and example. And that is the foundation of positive parenting. Moving to friends as support system, they are the ones who notice early signs like social withdrawal or changes in mood such as becoming irritable or unusually quiet or loss of interest in hanging out after school. A friend offers their presence, actively listening without judgment, validating feelings, and being a safe space to vent. Over time, adolescents support each other by sharing vulnerability, like feeling bad together for not getting good results. They reassure their friend that it's okay to struggle sometimes and offer a positive distraction, suggesting a walk, a cricket match, or maybe helping them with the artwork, anything that gives relief from without avoidance. In short, peers have a healing power that family or clinicians often don't. Coming to teachers as support system, so teachers are often the first responders to adolescent distress. They notice red flags like sudden drop in academic performance or changes in classroom behavior like isolation or irritability. Teachers often encourage a growth mindset, praising efforts instead of marks and building a sense of community through group activities. Finally, teachers make students feel seen and heard. Sometimes a simple, you seem quieter than usual today, do you want to talk about it, can open the channel for help seeking. So teachers just don't educate, they often detect, protect and connect with adolescents. In India, several national initiatives are now addressing adolescent mental health in schools. For instance, Project Mate trains school counselors in resilience and stress management. Peer support program builds peer mentors who identify and support distressed students, and ongoing programs like Manu Darpan and School Health Wellness Program train teachers and offer helplines across thousands of schools. Together, these efforts make a national shift towards preventive school-based mental health care. The MNC task force set in 2023 has emphasized that students' mental health must be nurtured within medical institutions. Each medical college is now to form a mental health and well-being committee, integrate mental health into orientation and curriculum, and ensure access to counseling and support services. We here at Mahatma Gandhi Medical College and Hospital, Jaipur, have a dedicated mental health and well-being committee constituted in line with the recommendation of the National Medical Commission and the report of National Task Force on Mental Health and Well-being of the Medical Students. These are the members of the committee. Coming to therapists as support system, they support adolescents by working across all aspects of life, cognitive, behavioral, emotional, and social. A therapist does not just treat problems, they teach adolescents how to live, relate, grow with balance. Cognitive strategies focus on changing the way adolescents think about themselves and their situations. Let's see a video of how thoughts are structured in therapy.
Imagine you're feeling down and don't want to do anything. Unhelpful triangle. Thought. Nothing is fun anymore. Feeling. Sad and tired. Action. Staying in bed and not playing with friends or doing activities. Helpful triangle. New action. Getting up and going for a bike ride with friends, even though you don't feel like it. New feeling. More energetic and a bit happier. New thought. Sometimes doing things can make me feel better, even when I don't want to.
adolescent says that I failed my test, I'm useless, we start by identifying distorted core beliefs and help them see them as a distortion and not a fact. Then we challenge negative self-talk by asking, is it true that you always fail? Reframing the situation helps them view problems differently, like you did not fail as a person, you just failed in just one subject. Alongside this, we focus on identifying strengths like creativity, humor, or kindness, which often get overshadowed by their self-criticism. Finally, we promote future-oriented thinking, helping adolescents visualize realistic goals and hopeful possibilities. These strategies help adolescents break cycle between negative thoughts, difficult emotions, and unhelpful actions, allowing more adaptive responses in everyday life.
Imagine.
Behavioral strategies often focus on action that helps adolescents convert insight into small achievable habits. Let's see a video on behavioral activation that we promote in therapy.
Depression and anxiety are very common and often co-occur in young people. When experiencing depression or anxiety, our intensive thoughts and feelings can be overwhelming. It's natural to feel demotivated and start avoiding things, even activities we enjoy before, which heightens feelings of sadness and worry. Behavioral activation is a technique used by mental health professionals to help people cope with depression and anxiety. It involves systematically scheduling and engaging in positive activities to break the cycle of withdrawal and avoidance, improve one's mood, activity levels, and functioning.
So we start therapy with setting achievable goals. Mirror work helps build body confidence and is often used with adolescents who have body image issues. They are encouraged to look into the mirror, name one neutral fact about themselves and one positive quality, like these are my eyes and they are kind when I smile. Journaling and mood tracking improves self-awareness by noticing how mood changes with activities. Enjoyable activities are encouraged, such as playing cricket or helping someone in need. These naturally replace the unhealthy coping. Routine and sleep hygiene are essential as consistent sleep time, digital curfew, and balanced study breaks restore energy and helps in focusing. Finally, adolescents are taught to develop an exit plan for risky behaviors, like politely refusing a substance or leaving a triggering online group. Every small action builds a sense of control and discipline, turning progress into motivation through behavioral strategies. Emotional regulation strategies help adolescents recognize and manage their feelings rather than suppress them. First, we teach identifying and expressing emotions, moving from vague statements like I'm fine to identifying I feel anxious and disappointed. The worry time technique allows them to set aside 1 hour and gradually 15 minutes a day to think about problems instead of worrying all day, building containment. Grounding and mindfulness exercises bring them back to the present. Let's see a video on 5-4-3-2-1 grounding technique that we often use in therapy.
Steady will take you through your five senses and remind you to be present. Be able to stay calm through tough or stressful situations. Take a deep belly breath to begin. Look around, find things that you can see, and say them out loud. Pay attention to your body and think of 4 things that you can feel, and say them out loud. Listen for 3 times. Say the 3 things out loud. The 2 things you can smell. It's fine to move to another spot and smell something. If you can't smell anything, then name your favorite 2 smells. Say 1 thing you can taste. If you can't,
So grounding techniques along with breathing techniques like box breathing or alternate nostril breathing, they calm the nervous system in crisis. Lastly, we reinforce self-care and self-compassion through journaling gratitude, engaging in hobbies and talking kindly to themselves instead of with criticism.
stay.
Lastly, social strategies focus on how adolescents relate to others, learning to build healthy, respectful relationships. We often teach adolescents Dear Man in therapy, a strategy that helps them communicate with others within their boundaries through assertiveness. Let's see a video on Dear Man strategy.
The first part of the acronym, DEAR, stands for what we do, and MAN stands for how we do it. D stands for describe the current situation. Stick to the facts. Tell the person exactly what your needs are. E stands for express your feelings and opinions. Don't assume that the other person knows how you feel. Use I statements. Avoid blaming or accusing. A stands for assert yourself. Ask for what you want, or say no clearly. Others usually don't know what you want unless you tell them. R stands for reinforce. Explain the positive effects of getting what you want or need, and reinforce the relationship still matters to you, regardless of the outcome. The second half of Dear Man addresses how we communicate needs, wants, and boundaries. M stands for be mindful. Keep your focus on your goals. Maintain your position. Don't get distracted by others or go off topic. A stands for appear confident. Use a confident tone and make good eye contact. N stands for negotiate. Come into the conversation ready to negotiate. Offer and ask for other solutions to the problem. Focus on what will work.
So these strategies empower adolescents to protect their boundaries and express their needs clearly. Improving mental health requires a holistic approach. Healthy diet and a balanced lifestyle help nourish body and mind. Prioritizing adequate sleep promotes emotional stability and clearer thinking. Regular physical activity releases mood-boosting chemicals while yoga and meditation foster relaxation, self-awareness, and resilience. Combined, these habits offer a simple yet powerful path to a better mental health and well-being. Now let's see a video on what our Honorable Prime Minister and Dr. Sudha Purti talks about adolescent mental health.
आपको किस चीज की पौधा है भाई? मान लीजिए 100 मार्क्स का पेपर है, अगर आपका दोस्त 90 ले गया तो क्या आपके लिए 10 मार्क्स बचा है क्या? आपके लिए भी तो 100 है ना? जीवन में रात कितनी ही अंधेरी क्यों ना, लेकिन वो रात ही है, सुबह होना तय होता है। और इसलिए हमारे लोग पेशेंस चाहिए, आत्मविश्वास चाहिए। शॉर्टकट नहीं, शॉर्टकट भी करनी है, कोई शॉर्टकट नहीं होता। एक पेशेंस होना चाहिए, धीरज होनी चाहिए, और हमने जो भी दायित्व मिलता है उसमें जान भर देनी चाहिए, उसको मस्ती से जीना चाहिए, उसका आनंद लेना चाहिए। मुझे मेरे अपने सामर्थ्य से इसमें वृद्धि करनी चाहिए, मुझे मेरे सामर्थ्य से समाज को ज्यादा देना चाहिए।
How do we convey our message to our parents?
We should talk it out, even though they may not like it. Parents, I used to tell my daughter that about you, someone should not come and tell me. About you, you should tell yourself. Parents, keep the channels open, don't close. Closing is the worst thing in life. If the child is scared of you, that's the worst thing in life. Then they will get somebody. Or if they, who can tell them the best advice other than mother? So please keep the channels open. You may not like it at times. Many times actually they don't like it. Okay? But allow them to talk to you. And explain to them in case you are not happy.
Context. They often minimize the problems, so we depend on parents and teachers too. Confidentiality is important. Safety overrides the privacy. For adults, assessment is more straightforward. They can consent and give full history, and they can take the full responsibility as well. But in fraud, adolescent assessment is developmental and systemic, and adult assessment is individual and symptom focused. What are the key principles of the adolescent assessment? Confidentiality and privacy, which is essential to build the trust. Non-judgmental attitude, we should listen empathetically without judging them. Comprehensive and preventive focus, that is beyond treatment and include health promotion as well. Family and community involvement with consent, and gender sensitivity in especially country like India. Now let's discuss the standard HEDIS framework, which is used to assess the adolescent health. HEDIS stands for H stands for home, which focuses on the family relationship support and safety. E stands for education and employment, which focus on school performance and attendance, activities including hobbies and social media use, drugs like tobacco, alcohol, and any other drug abuse, sexuality like puberty and sexual activity, sleep pattern, and suicide including risk-taking behavior and mental health. Now let's discuss in detail what are there in the HEDIS framework. At home, we ask who do you live with, tell me about your family, tell me about your support network. In the education aspect, we will be asking how your school is going, what do you like about the school, and tell me about your friends. Activities, we can ask what they do in their free time. Do they know anyone that is starting to experiment with any drugs? Do any of their friends drink alcohol, or do you drink alcohol? Diet or drugs include tell me what you ate yesterday, what kind of things do you do, or do you are interested in making dinner. Self-esteem or sexuality includes how do you feel about yourself and the way your body looks. Safety and suicide includes high risk taking behavior like do you wear a bike helmet, how is your mood, and have you ever thought about harming yourself. Sleep, which is an important aspect, we should ask what time do you sleep at night. Is your sleep regular, or do you wake up once in a sleep? Now let's discuss some national health programs for the adolescent health. Rashtriya Kishore Swasthya Karyakram, which was launched by Ministry of Health and Family Welfare in the year 2014, includes nutrition, sexual and reproductive health, mental health, substance misuse, injuries and violence, and non-communicable diseases. Now, what are the sub-programs covered in the RKSK? Important one is AFHC, that is Adolescent Friendly Health Clinic, which provide the confidential, non-judgmental services by the trained counselors. Sathya Education Program, in which peer educators act as the communicators between the health system and the adolescent. They use Sathya Kit and Sathya Salah app, which include flip books, games, and any FAQs on the adolescent health. Weekly iron and folic acid supplementation, school health and wellness program, and Nasha Mukt Bharat Abhiyan, which provides prevention and rehabilitation for the substance abuse children. Adolescent friendly health clinic, they aim to provide and reinforce health promoting lifestyle, detect physical, emotional, and behavioral problems, provide any anticipatory guidance against the risk taking behavior, immunize, and provide the parental guidance. Adolescent friendly health clinic, they should have a separate room for that, a simple room with a wall paint, colorful furniture, bright posters with the appropriate health messages should be there in the adolescent friendly health clinics. Basic amenities like sitting arrangements, clean drinking water should be provided. What are the principles? Adolescent clinic should be made available, accessible, approachable, acceptable in the society, appropriateness, and affordable. We can see that 11.9 million adolescents access the adolescent-friendly health clinics in the year 2022 and 23. Now we'll discuss one case. Master X, which was a 16-year-old boy, came with the parents, presented with chief complaints, that is easy fatigability, laziness, and weight gain in the last 6 months, excessive gaming, low mood, and body image concerns. Parents reported regular vaping, which was a complaint received from the school, and academic decline. Now, as we apply the HEDIS framework in the home, both parents are working, education is below average, and he often misses school due to tiredness. In eating aspect, majority of time he eats fast food and sugary drinks. Activities, his screen time is more than 8 hours a day and play online game most of the time. Depression, he feels self-conscious about his weight and has low self-esteem. His BMI is 27.3 kg per meter square and waist circumference is 98 centimeter. As we assess the psychological assessment, Dept was established. His affect was depressed, and in thought he was primarily preoccupied with the body image. And using the Hamilton Depression Scale, the score came out to be 14, which was moderate, and he found to have internet addiction test in the moderate category and nicotine dependence in a moderate category. Now, in routine investigations, we found to have borderline triglycerides with HbA1c of 5.7 and fasting blood glucose of 120 with ultrasound showing grade 1 fatty liver. Now, what are the issues that the adolescent is facing? That is overweight with pre-diabetes, body image issues, depression, and excessive gaming. Now, what we can do in a management aspect? There are two ways, pharmacological and non-pharmacological. Non-pharmacological changes include dietary and lifestyle modification with psychotherapy, and pharmacological management, antidepressants like SSRIs can be prescribed. proper dietitian referral was taken, and they developed a balanced low-calorie meal plan focusing on the whole foods, increase intake of fruits, vegetables, and whole grains, reduce intake of sugary beverages. Physical activity, we should encourage at least 60 minutes of moderate to vigorous physical activity daily, gradual introduction to enjoyable activities like walking, swimming, and cycling, and limit the screen time to less than 2 hours per day. Now I would like to invite Yukta for discussing the psychotherapy aspect of this patient.
For Master X, the therapeutic plan began with a detailed case history, and then we moved to psychoeducating him and his parents on his symptoms. Together, we set clear, realistic goals such as reducing gaming hours, improving mood, and reestablishing sleep routine. Finally, we implemented therapeutic techniques to build healthier coping and self-esteem. Our interventions targeted on all 4 domains: cognitive, emotional, behavioral, and social, to address Mr. X's difficulties holistically. Cognitively, we worked on modifying negative thoughts. For instance, during sessions, we found his core belief as being a failure. Over the sessions, we worked on reframing his belief of "I'm a failure" to "I had a setback, but I can improve." Emotionally, therapy focused on improving mood regulation and self-acceptance. Master X learned positive affirmations like "my acne does not define my worth" or "my weight does not define my worth." Box breathing and mirror work, where he practiced smiling at his reflection for 10 seconds and acknowledging one good thing about himself, which he identified as his hair, were used to manage self-criticism and build confidence. Behaviorally, we reduce maladaptive habits through behavioral activation, which is studying for 1 focused hour daily and going out for sports, and structured sleep hygiene and screen time regulation plans. We also introduce problem-solving training to handle daily stress more effectively. Finally, the social domain focused on rebuilding peer connections through assertiveness and refusal skills, and encouraging peer engagement like joining sports or group activities. Together, these interventions help him regain structure, confidence, and social balance. To summarize Master X's progress over the past 12 months, his gaming reduced gradually from 10 hours a day to about 2 hours, and it's now limited to weekends. Vaping was fully addressed. He identified triggers like boredom and peer pressure and achieved 10 vape-free days by the month 12. Sleep improved significantly with consistent bedtime at 10 p.m. and wake-up time at 6:30 a.m. In the social domain, Master X went from complete withdrawal to engaging in at least 2 social interactions per week, mostly football and group study. Academically, he showed better consistency. His homework is on time, participation has improved, and grades are slowly rising. His self-esteem has also improved. He is replacing negative self-talk with healthier statements. Overall, progress across all domains were achieved by 1 year. Thank you. Now I would like to invite Dr. Shalini ma'am.
So having understood the problems in adolescents and the way to assess them, I'll just give a take-home message. Where do we stand? WHO Southeast Asia, according to WHO Southeast Asia, 27% of the adolescents are population, that is nearly 360 million young people, which is highest for any region. While many adolescents transition from childhood to adulthood in a healthy state, too many face significant preventable health challenges. Still, almost 616 adolescents die every day in spite of the better health facilities in last 2 decades. The neurological conditions and the mental health conditions like substance abuse and self-harm are still on rise. Approximately 2 million girls of age 15 to 19 years get pregnant or are giving birth annually. We are still facing triple burden of malnutrition. Adolescents are often neglected by the health systems. Essential services like sexual and reproductive health, mental health, and infectious diseases, are prevention of violence and injuries, and substance use are often out of reach. They often face stigma and lack of privacy, leaving them deprived of the care they need. Over the past decades, countries have introduced adolescent-friendly health initiatives, but still these facilities, though have yielded positive results, the focus is largely overlooked. To address these gaps, we need to commit to develop adolescent responsive health system, which not only just this is not just about treating diseases, but also about empowering the whole generation. It is about ensuring that all aspects of health, including policies, laws, information, logistics, family and community involvement are met. It will enable adolescents and young adults to access high quality health services everywhere, anywhere, and without any restrictions. So I would like to close my statement saying that by prioritizing the unique needs of adolescents, we pave the way for healthier and a brighter future. Adolescent Health, invest now for a healthier future. Thank you.